Have I gone mad? I'm afraid so. You're entirely bonkers. But I'll tell you a secret. All the best people are. Alice from Alice in Wonderland. Alice in Wonderland syndrome was discovered in 1955 by John Todd. He named Alice in Wonderland syndrome after the Lewis Carroll's novel character Alice from Alice in Wonderland. Alice in Wonderland syndrome is a disorder which is closely related to migraines. Aura migraines to be exact. Aura migraines affect visual perception. Alice in Wonderland syndrome affects the temporal lobe, or more importantly, the temporoparietal junction, which is where your visual pathway is, according to the U.S. National Library of Medicine. Alice in Wonderland syndrome mainly is in children, but it does occur in some adults. People who have Alice in Wonderland syndrome do not normally seek medical attention. That is why only 5 cases have been reported since 2016. The people that do have Alice in Wonderland syndrome and they do not go treated torture themselves daily with misgivings of sanity. They constantly have to ask if something's real or if it's not, if I'm insane or if I'm not. U.S. National Library of Medicine calls this Alice in Wonderland syndrome to be seriously underdiagnosed. Alice in Wonderland syndrome is also very rare. It only occurs in about 10 to 20% of the population, according to Modern Medical Network. Symptoms of Alice in Wonderland syndrome often raise many red flags. If Alice in Wonderland symptoms do occur and they do become persistent, that means that there is something seriously wrong, such as a lesion of the occipital lobe or intoxication substance that is affecting the central nervous system, which means that your body can shut down and you can die. While Alice in Wonderland syndrome is rare, symptoms are not as rare. According to neurosurgery, all the symptoms occur separately, and they only occur for about a 5 to 20 minute time period. The first one that occurs, and is the most common, is microphagia, which is when things appear smaller than normal. The second one is telephagia, which is when things appear further away than they actually are. The third is macrophagia, which are when things appear larger. The fourth is metamorphophagia, which are when lines that are straight appear wavy, warped, or bent, or even blank. Pelophagia is when things appear nearer when they're actually further away. There are also many other symptoms that are claimed to occur with Alice in Wonderland syndrome. These are hallucinations, time loss, and seizures. While many symptoms of Alice in Wonderland are known throughout many medical conditions, the treatment is not as well known. There are many mysteries that Alice in Wonderland syndrome holds. It doesn't just affect children or adults, it actually affects anyone. According to neurosurgery, children who have Alice in Wonderland syndrome claim to have 50% more chance to develop infection and have a higher chance of having migraines when they are older. The causes, however, for Alice in Wonderland syndrome are unknown. As of 2016, only 5 cases have been published, and longer-lasting distortions are hard to find and the signals become more weak. People say that one cause of Alice in Wonderland syndrome are underlying medical conditions, such as epilepsy, depression, schizophrenia, infection, stroke, and even a virus. It is also said that taking cough syrup, allergy medicine, and the anti-seizure drug topamatrine causes Alice in Wonderland syndrome. There is also a form of Alice in Wonderland syndrome that is caused by drugs. It is called LSD-induced Alice in Wonderland syndrome. The treatment for Alice in Wonderland syndrome, unfortunately, there is no treatment. They they treat Alice in Wonderland syndrome as the individual, not just as a broad spectrum. According to U.S. National Library of Medicine and clinical practice trials, they treat Alice in Wonderland syndrome with antiviral agents and antibiotics, but it doesn't mean that they necessarily treat Alice in Wonderland syndrome. Rather, they treat the underlying medical factors such as epilepsy or infection. However, never, ever, ever has Alice in Wonderland syndrome been treated with antipsychotic drugs. Someone who does not have a mental illness, you do not give antipsychotic drugs to. It'll make them enraged and agitated even more, and it could make their perceptions even worse. There are chronic cases of Alice in Wonderland syndrome that do exist, and the way that they help treat these is something called a migraine diet. In conclusion, Alice in Wonderland syndrome disorder holds many mysteries. Alice in Wonderland syndrome is also very rare. The main points of Alice in Wonderland syndrome are that they are aura migraines and that they are closely related to migraines, and they have to deal with visual perceptions. They have many, many symptoms, and it holds many different mysteries. And as of right now, there is no treatment or even there's an unlimited list of causes for Alice in Wonderland syndrome. While Alice in Wonderland syndrome is rare, many suffer but do not report it. Rather live in their own torturous world called their mind. Alice in Wonderland syndrome is not a mental illness, which is why people cannot treat it as one, which means that you cannot treat somebody with Alice in Wonderland syndrome with antipsychotic drugs. Alice in Wonderland syndrome symptoms are always red flags because there could be some serious underlying medical conditions such as the occipital lobe could have a lesion, or there's an intoxication substance in the central nervous system that is shutting the body down. Thank you.